Additional comments, questions?
Go to page 1, and I'm only asking this to get clarity for myself. The reason that these are actually being redone or maintenance is because of a vibration test that was taken. So I would assume that this is trained equipment that was not initially installed by trained certified technicians.
It was installed by Trent.
It was installed.
Yes.
Okay.
When the convention center was built.
Okay. So this is just normal wear and tear maintenance on
Normal maintenance is to prevent.
printer. Okay.
We have an operator. Constellation is our operator, runs the system on a day-to-day basis. This was deemed not normal maintenance, so we went out for a separate bid for this work.
Another perspective on that may help you is the equipment has been running. It has been maintained. There is an engineering structure there that says it's approaching the end of its useful life expectancy. This action by the committee and the expense tied to it will add to the life expectancy on the back end of the machine. In other words, it is proactively removing the need for you to replace them completely.
And if we had to, what would that cost? We just off the rough.
I would say no less than $1.3 million, $1.4 million.
Okay.
And that's just the equipment. That's not the install.
That's why when I looked at this, I said, wait, how can they put 2 chillers in for 200? And then you had to explain your scope, because I knew it was a low number, but it's preventative maintenance, so understood.
We okay with any other comments, questions? All those in favor?
Aye.
Opposed? Abstentions? 1 abstention. Okay, the MWB participation plan for the chiller reconditioning project is approved. Thank you.
Thank you. Okay, thanks.
Okay, next we have City of Pittsburgh, Department of Personnel and Civil Service, UPMC Mercy. Good afternoon.
Good afternoon, Commissioners. I'm Todd Siegel, the Manager of Employment with the City of Pittsburgh Personnel Department. To my left are Joel Acey, who's the MWDBE Thank you. Project Manager for UPMC, and to his left is Carol Jennings, the Manager of UPMC Mercy Occunet. The project before you today, the City of Pittsburgh Department of Personnel is required under civil service laws and rules to appoint a civil service physician to conduct and report on pre-employment, promotion, reinstatement, return to duty medical examinations for the city's arduous positions. In addition, there are fitness for duty medical evaluations as required that the civil service physician is responsible for. Furthermore, based on the federal DOT workplace drug testing regulations, and collective bargaining unit agreements with the city and the city's drug testing policies, the city's physician or the medical review officer is responsible for the collection of specimen and reviewing and reporting on random drug testing for city CDL drivers, firefighters, and other required or requested random drug testing. Currently, the city employs approximately 2,600 employees who are in arduous positions. Last year, there were 851 medical examinations conducted and 6 fitness for duty examinations. In addition, the MRO collected specimen and reviewed drug test results for 1,382 employees. For this project, the Department of Personnel advertised a professional RFP for a 4-year contract totaling $722,000. We posted the RFP on July 1st of this year for a 4-week period. And we also contacted the URC office for guidance with respect to any MBWB businesses to whom we could send our RFP. At that time, Mr. Kevin Pugh from the URC sent the RFP out to 4 businesses that were from their listing. At the close of the RFP, we had 1 respondent proposal submitted, and that was from UPMC Mercy Occunet, who happens to be our current contractor for these services. Their proposal was reviewed and accepted by the city, and we immediately contacted the ERC office to begin what was necessary for the participation plan. UPMC Occunet has worked closely with Anthony Manella to ensure MBWB participation, and we currently have before you 5.6% MB participation. And I would defer to Carol and Joel if you had any further questions with respect to that.
Thank you.
Is this a similar situation where the labor side of things, it's more, when you're doing exams, it's more physicians looking at the patients and it's really not much product or additional service? Is this a similar situation? That's correct.
I would say so. I won't be examining anyone at my house, so I take it you have to have sufficient facilities to.
Yes, we have a medical director on staff, Dr. Joe Lanzarato. He's been the medical director for the past 13 years with the City of Pittsburgh, and also the MRO service position. We currently have a nurse practitioner on staff, and I also have 6 other staff members who are women that do the testing. They're all certified DOT to do the drug and alcohol testing too.
You said 6 women. What are the other demographics that you assist?
We have a nurse practitioner, and then 6 other, which are 3 nurses, myself, the manager.
Are the nurses female?
Yes.
Is a nurse practitioner female?
Yes.
Are any of them African Americans?
No.
So a total of you said 6 women. Were you giving me the breakdown of the 6 women?
Yes. The nurse practitioner, myself, 3 nurses and 2 medical assistants, which equals 7. And then the medical director, Dr. Lanzarato,
Okay.
which is
Are the
male.
medical assistants male or female?
Yes, male.
Both of them are male?
Hmm. Well, one male medical director. He's the doctor.
Right. The medical assistants are
2 female.
2 female. Okay. So of the 7 individuals, 6 are women and 1 is a male?
So there's actually 8, 7 are female, and 1 with the medical director, Dr. Joe, which
Okay.
he's the male.
Okay. And then the supplies that are going to be used are for what
It's
part
very
of the
minimal
process?
supplies of what we use with the RFP, and it consists of, when we do, the bulk of it is the drug testing piece, which we use the Perel for your hands. We use gloves, and then the kits for the drug testing are supplied by the MedTox, which is the SAMHSA certified drug and alcohol testing that we use for that. And they are not minority for the piece of that, for the business piece. But we sat down with Anthony because we tried to come up with more, hey, what can we look at for more supplies for this? And with Anthony's assistance and Joel, we sat down and kind of went through table paper we use for exams. We use the Perel, we use the gloves, we use alcohol wipes, even down to the copier paper. And that's where we came up with the 5.5%.
And is the figure here an estimate? Obviously, you don't know how many people will need the exams since they're not mandatory, right?
We're going by the last 4 years, like the average with that, which what Todd had said.
Correct.
And is this for a year or multiple years?
It's a 4-year contract.
This covers
$180,000 per year.
I've got to ask, I've been on this board now for 5 years, and your numbers are pretty consistently low or no. And I'm reading here your supplier diversity program, which was instituted in 2006, was re-engineered to fulfill the commitment to create a nationally renowned center of excellence. Maybe you guys can help me out as to how you're trying to attain this, because it hasn't been done since 2006. So can maybe, by you explaining to me what it is you guys are actually doing to increase your minority participation, even on supply, maybe I can get a little better understanding.
Let me re-clarify your question. You're asking how we do our program, or?
Not so much how you do your program, but how are you going about increasing your levels of minority participation on both service and supply?
Good question. Good question. We actually get it all the time, as we're always in the papers for our efforts. The way we actually do it is that we work through our supply chain management organization, who controls all the spend for UPMC, the hospital system, as well as the insurance services side being UPMC Health Plan.
Okay,
As
now,
a,
let me
as
just
a,
stop you right there. Is this something that's contracted out? Is someone else doing this for
Yes,
you?
this
or
is-
this UPMC?
the products that we've identified are actually under contract with another major supplier, and we're having to essentially break that contract to ensure we have diversity within this specific opportunity here. The goal is not to actually do that, but in terms of how we actually look at all of our suppliers, commodities, their spend, what we do, and how we actually go about doing it, is to identify those goods or services. What are we doing now, then what aren't we doing? And we work closely with our business areas through supply chain management to ensure that any new opportunities have diversity if they are not under contract as of now.
Is the 40,000 discounted because it's supplies?
It should be.
Well, it depends, are they full?
Are they a broker or are they a supplier?
Manufacturer of a product, or how do we break it down?
I don't know, what,
Or a supply? Or a supply, they're a distributor?
So we count that as 60%?
I don't think so.
Or full.
I thought that was only on construction contracts, not on
Okay.
professional service contracts. I could be wrong about that.
Right,
it
but I
seems
mean,
like
I
a supplier is
agree
a
with what
supplier
you
is a
said.
supplier.
Right, we don't know whether they're a broker or not.
If they're a broker, if they're not a broker, that's what we discounted. But you said you're a distributor.
They are a distributor.
So if you're a distributor and they have that contract for this value, then that's their value. It's their value.
Is RS Supply here with you today?
No.
I mean, what was the effort that was put into increasing? Was there anything other than
absolutely.
just typical, this is the way we do business and,
Good question. In my role here as a supplier diversity professional is to challenge the norm, is to challenge how we actually procure our goods and services. It also comes from the supply chain management area as well. What we typically look at, especially in this specific case, we need to look at what we're doing currently. And let's figure out the basis and or the floor for how we're actually doing this, performing this service. And we had taken a step back to see what in the room is there that we can actually identify as a good or service that we're providing to this individual or for the employee walking in. And it's a rather short period of time that he or she is actually with us for the actual drug screens itself. As Carol mentioned, that we're using Purell, we're using the blue nitrile gloves, we're using these things, these clinical items that are purchased at a large volume for the whole hospital system. And having said that, we want to also look at what are the things that are supporting this as well, that are, again, MRO. They're business as usual items that we have. And then from there, we need to figure out, make a business decision as to how we're going to actually either break a contract or create new opportunities based off of what we see in front of us. In this specific case here, it's very clinical, it's very clinically driven, and that limits us in terms of how we're actually performing this service for the city of Pittsburgh and the goods and services that we're actually using to support that service.
Well, I mean, out of each of the annual kind of allocation, you know, there's some things you've tried to get participation from the supply, but there's just probably a greater majority of it is for the personnel component. Would
The
you?
majority of
Right.
it goes towards staffing, yes.
Right.
Yeah. So if anything, I mean, you asked a series of questions, Jason. I don't know if I heard if there were any African Americans in the personnel end of things. So, 6 women, yeah. So, I mean, I get the supply side, and I get the supply chain management, and especially this particular component is probably pretty small on this project, but your point is well taken on the overall scope of things, Sean. But on the employment side, you know, I'd like to, you know, hear, not necessarily here, but I think you guys need to give consideration, a little better consideration in, diversification in terms of your hiring practices, and to whatever extent you can make a much more diversified employment base, I think is where there needs to probably comment and thing for you to take back.
In fact, I did have one, and she just left us about a month ago, so I can't vouch that I have her anymore with us, but.
Do you have a training program with your company?
We
Some type of
train
training program?
as far as the drug testing?
New folks coming in?
Oh, absolutely,
All right.
yeah.
And I guess the way we're looking at this and overall, just looking at how when you have your candidates who you're bringing on and hiring,
Yes.
I guess I'm looking at, if they're all a certain demographic and they don't meet certain demographics that fit our comfort zone of moving forward and improving this agenda, it can be looked at as something that maybe that they're not applying, or certain demographics aren't applying. How do we reach out to the community, or reach out in a sense where we have a training program that's built to kind of welcome those who may be newcomers or not even know about this field, to give them an opportunity to maybe step in and even at an entry level to give them an opportunity. So I'm just looking at it from that perspective. That's the reason why I asked the question of the training.
And that's a larger
And it's a new
systemic.
hire training process that they go through.
Right.
Does our supply have other contracts with UPMC as well, other than this?
Sure.
No, they're actually part of our MWDBE development program. So as part of our first professional, I need to grow businesses. I need to ensure that we're affording opportunities for our small businesses, our minority-owned businesses within the community. And this is actually a way for me to actually get them in the door, to actually get some activity, so we can actually start growing this organization as well. So your point, duly noted, and is tantamount to what I do as a supply diversity professional. And this is one of the ways that are outside the box creative that I use and that our organization uses to ensure that we're keeping the door open.
And just to say,
Wait, I didn't understand. They do or do not have?
Do not. They are not a current supplier.
Okay.
If this is approved, they will be now a supplier of UPMC.
with the appreciation of Sean's question and how he's driving this question, it's not to let UPMC off the hook. We know the ins and outs, but it's not to beat you up, Joel.
Oh, no, not at all.
I know you. I've known you for many years. I know you when you was in Highmark. And moving over, understanding where you are now, it's a tough environment when at least I know from what I experienced on the construction side, it's a tough environment on the corporate side, which I think, hammering you won't make the difference. So, or that change.
Yeah, I'm about to turn the table around and tell you.
But it's not the get away from where I think, Sean's overall point about the corporation and how they're looking at viewing their packages when they're soliciting for bids. But nevertheless, like I said, I just know that when we're driving these questions, it goes to you. You can carry it back to your folks, but it's another challenge at hand.
Absolutely.
Tell them what we said.
Yeah.
Right. Jim Overton says in here. But absolutely, again, I laud this group and for what you're doing, and it's reciprocal. It really does help me as a professional to carry that message internally to our internal constituents who aren't sitting at this table here, who aren't representing supplier diversity, who need to be told this is how we're going to be doing things. So it's very helpful.
Any other comments, questions?
A motion to approve.
Properly motion.
I'll second.
And second, additional comments, questions, discussion? All those in favor? Opposed? Abstentions? 2 abstentions, 1 opposition. Okay, the MWB participation plan is approved. Thank you. Okay. Okay, finally, we have City of Pittsburgh Bureau of Building Inspection. We have the Animal Rescue League Shelter and Wildlife Center. Is there someone here for that?
Yeah, Joe. Dan Rossi with, is this Joe? You look like Eddie George. Yeah, a little bit. I thought that was Eddie George over there.
Good afternoon. Are you really fast?
Still.
Okay.
Just turned 50, that's still.
Good deal,
Yeah,
good
lots is
deal,
still good.
good deal,
Thank you, appreciate it.
good deal. True.
To get away.
Good afternoon. You want to tell us about your plan here? Animal storage.
Basically, the city wants to engage into a contract with the Animal Rescue League as an independent contractor to perform the professional services of detention, care, and euthanization of domestic animals, in a nutshell.
You have, this is a $1.2 million contract.
Yes, it's a 3-year.
What's the 3-year?
Yes,
So
it is.
approximately $400,000 a year, thereabouts?
Exactly.
Okay.
Yes.
And you have a participant in here for $13,500. Can you tell us about that?
Yeah, he's an individual that supplies us our, yeah, it's directly across the street. That's why we use the guy. We've used him for a couple years. But he gives us our general supplies, paper towels, those type of items that we use for the most part. The bulk of our supplies that we use are specialty supplies, medications that are controlled substances that you rarely can only get through national organizations like Bayer for the most part. Our other supplies, things such as dog food, kitty litter, tons. We use 3 tons of kitty litter a year. We basically get those through major manufacturers that we pay either the cost of that or for the shipping of that, and that's it. So they're rates that we can't get anywhere else, basically, for those items. But the bulk of what we do is salary-driven for the most part. We don't really sub anything out at the league.
You're with the animal shelter? Excuse me.
Yes, we are an animal shelter.
Okay.
We take in approximately 11,000 animals a year. The contract with the city represents about 15% of the animals that come to our doors for the most part. So the contract basically is Gerald's group has the trucks, they go out, pick them up. The city of Pittsburgh does not have their own animal control facility like most cities across the United States, so we act in that manner at that point in time. So we do the stray hold. We'll hold an animal from anywhere from 72 hours to 10 days, trying to locate its owner. If an owner is not found, then we evaluate that animal medically and behaviorally. If it passes our tests, then we adopt it out. Last year, approximately 70% of the animals that came into us were successfully adopted out. Of the 30%, 10% were medically euthanized, 10% were behavior animals, either animals, dogs that bit, or feral cats, which you can never retrain or really adopt out at that point in time. The other 10% were owner-requested animals that came in directly.
Are you guys for-profit or nonprofit?
Nonprofit.
You have multiple locations?
We have the one main location on Hamilton Avenue. We also have a wildlife center, which is located in Verona, and they deal with the wildlife side of what we do.
What about your staff? Do you have any diversity amongst your staff?
Well, probably 95% of our staff are female, as most nonprofits are. We're female-driven for the most part. We do have a component, yes, component of minority staff as well.
I make a motion for approval.
Properly motion and second. Additional comments, questions, discussion? All those in favor? Aye. Opposed? Abstentions? Okay, then the MWB participation plan for the animal storage contract is approved.
Thank you.
Thank you.
For notation, in the future, as a nonprofit, and you guys can actually appeal for a waiver for the commission. We still will review it, look at it, but we just review the because you're a nonprofit organization, so.
Okay.
I just kind
Well, but that's grants. This is a contract.
Well, I thought
It doesn't, no,
It doesn't
no.
matter whether, okay.
No,
But they can't
those-
show MBE is what I'm saying, as them being primes as an MBE, because we can't get certified as an MBE as a, they can have MBE contractors.
Yes.
But,
Contracts do not get waivers.
So it's just the
That's
grants? I thought it was
The grants
contracts.
are the waivers.
well, I
'Cause
stand
they-
corrected, Mr.
Right,
Chair.
right, so they're okay. They're subject to,
You're still,
right.
right, Gerald, you still would come before us. But, yeah.
Thanks, gents. Okay.
You know, and I also appreciate what you guys do for the city. It's
Well, thank
very,
you.
very valuable. Very.
Thank you.
for animals.
He's a great guy.
Yes, okay.
So that boa constrictor that's been in my backyard, you come and grab it?
Okay, well, good. With that, is there any other closing remarks for the commission?
Glad Dawn is doing all of this good work. Thank you, Dawn. I'm just glad that you're doing all this good work.
Thank you, thank you.
Congratulations, Don.
I really appreciate all the support I'm getting from you guys. And again, my staff, I couldn't do anything without these three. It was really tough.
Okay.
Yeah.
With that, we stand adjourned then.
Thank you.
Thank you, guys.